Has somebody you care about begun to exhibit subtle but troubling changes during the past year? Most people believe that death in old age occurs suddenly, but the reality is that the body tends to give gentle warnings months, sometimes even a year, prior to life reaching its last stage. The catch is most people overlook the signs since they appear minor initially. It's only in retrospect that families would later know the signs were there all along. But by the time it's too late to prepare, too late to make those last memories count in this video, we're going to discuss 5 important signs that tend to show up a year or so before an elderly individual dies. Some of them may be items you've observed but dismissed as normal aging. Others may be adjustments that seem small but actually cue the deterioration of the body. The earlier you recognize these signs, the better you can offer care, appreciate valuable moments, and most importantly, that your loved one's last stage of life is full of comfort, dignity, and peace remain with us until the end. Because these 5 signs can prepare you emotionally and practically for what's to come. When you know what's occurring, you won't be surprised. You'll be able to make the most of the time you have remaining with those you love. Now let's begin. Number 1, notable weight loss. One of some of the earliest and most significant indications that an individual is entering the last year of their life is unintentional weight loss. Initially, it could be quite slight, a belt that needs to be tightened, suddenly clothes that look looser, or a hearty appetite that gradually diminishes. Most families write it off as normal aging. But the reality is that losing weight unintentionally is seldom a positive sign, and more than likely signifies that the body is no longer taking in nutrients. Effectively, muscle mass is shrinking, and vital systems are slowing down. Aging naturally results in some muscle loss, but when it occurs too rapidly, it's an indication that something more is going on. The body might be having a problem digesting food normally, or the individual may no longer be capable of breaking down protein as efficiently, which results in muscle wasting. This loss of strength doesn't simply make it tougher to move. Challenging it raises the risk of falls, weakened immune system, and leaves the individual susceptible to infections. Another cause of weight loss in the last year of life: changes in appetite. Many older people simply don't feel as hungry as they used to. Their sense of taste fades. Food no longer tastes good, and they may begin skipping meals or eating much smaller amounts. This isn't merely a matter of choice. It's a physiological change. The body, sensing that it's closing down, no longer triggers the brain to search for food, because frequently the outcome: less energy, less strength, and a progressive weakening of general health. And then there's the contribution of underlying medical illnesses. Weight loss is a typical manifestation of long-term diseases such as cancer, heart failure, or kidney disease, all of which may start advancing well before more readily apparent symptoms arise. Even conditions such as depression or dementia can cause a decrease in eating, resulting in a downward spiral when the body is not getting sufficient fuel to support itself. Some families attempt to eliminate the issue by urging their loved ones to consume more, giving favorite foods, or adding protein drinks to meals. But if weight keeps falling despite these measures, it should be noted that the problem is not diet alone. It's the body preparing for a deeper shift at this point. Pushing big meals may not be effective. Instead, prioritizing comfort, easy-to-eat food, and hydration can contribute more significantly to quality of life. If you see important weight loss in a senior loved one, particularly if they're consuming less, feeling weaker, or having trouble keeping up, it's time to take notice. This isn't solely about how they look. It's about the body speaking and getting that message. Now we'll help you get ready for what lies ahead with clarity, compassion, and being able to make every last moment count. Number 2, extreme weakness and fatigue. One of the most significant changes in the last year before the end of life is a deep ongoing fatigue that doesn't resolve with rest. It's not merely being a little tired after a hard day. It's an extreme exhaustion that makes even ordinary tasks feel Herculean. Getting out of bed is a struggle. Walking across the room is a task, and tasks that previously felt routine, such as cooking dinner or even having a conversation, begin to become too exhausting. This isn't solely due to aging. It's an indicator that the body is holding on to its remaining energy as organ function begins to decelerate. The body begins to prioritize what is most necessary. The heart doesn't circulate blood as well. Circulation becomes weaker, and muscles don't receive the same amount of oxygen that they used to. This is why so many elderly patients in their last months of life feel feeble, unsteady, and cannot maintain the same amount of activity they used. To another important consideration is metabolic decline. The body is set up to generate and utilize energy. But as it enters its final phase, that energy is channeled elsewhere rather than powering movement. The body becomes geared towards conservation. This is why an individual in decline might begin sleeping more, requiring longer naps throughout the day, and having difficulty remaining awake for extended periods. Some will even see sudden energy drops where they feel great 1 minute but totally exhaust the next. But maybe the saddest thing about this process is the emotional toll of fatigue. Many of the elderly who previously prided themselves on their independence start feeling frustrated or even humiliated that they can no longer do what they could. They might pull away from talk, start avoiding social interactions, or give up on hobbies. Not because they don't want to, but because they just don't have the energy. This can result in a cycle of isolation where they give up trying a log together, which only serves to speed the decline for families. Seeing a loved one transition from active and interested to tired and withdrawn can be difficult. It's easy to think they're just lazy or that they need to power through, but the truth is that coercing activity won't help. What is most important is listening to their limits and letting them rest when required, and making their last days as comfortable as possible. If you see a loved one with severe, persistent fatigue that isn't alleviated by rest, take it as a sign that their body's undergoing a significant change. This is the time to treasure conversations, make moments of calm, and support them without expectation, because ultimately, what matters most isn't how much they can do. It's that they feel loved, understood, and comfortable. If you're still seeing this video and benefiting from these insights, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I suggest you subscribe and turn on the bell so you don't miss any videos. Your support helps us keep making good content to inform and inspire you. Now, let's continue number 3, anchor cognitive confusion or withdrawal as an individual reaches the end stage of life. One of the most striking changes can be observed in the way they think, interact, and communicate with others. You might observe that a person who was previously sharp and engaged begins to forget things, more frequently have difficulty following conversations, or appear disoriented in familiar environments. They might repeat themselves, forget names, or lose their sense of time, even when they never experienced memory problems before. These small cognitive shifts can occur months or even a complete year prior to death. This isn't merely everyday forgetfulness. The brain, like any other organ, needs a constant flow of oxygen and nutrients in order to function correctly. But as circulation diminishes and oxygen to the brain is diminished, cognitive function begins to deteriorate. The individual will become easily disoriented, have trouble making decisions, or struggle to know people in situations they've been familiar with for years. Sometimes they may even experience periods of lucidity, followed by sudden attacks of confusion, nearly as if their mind is extinguishing. And out another typical sign, emotional withdrawal. Someone close to the end of life tends to lose interest in social interactions. You may find them talking less, or sitting for long stretches, just sitting in silence. It's not that they don't care about their loved ones. It's that their brain no longer handles emotions and engagement the way it used to. Conversations become exhausting. Loud places feel overwhelming. And eventually, many seniors pull back into their own world. You may also observe changes in mood and behavior. Some people become irritable, anxious, or frustrated easily. Others appear unusually calm, detached, or indifferent to things which previously concerned them. This is not merely a change in personality. It's frequently an outcome of the brain compensating for the body's deterioration. As cognitive function, Sulla's emotions become more difficult to access, and the individual may cease to respond to situations in the manner they previously did for family members. This phase can be particularly challenging to bear witness to a loved one. Lose touch with reality or draw away emotionally can feel as though losing them before they're truly gone. But it's worth keeping in mind this isn't something they have control over, rather than trying to draw them back into conversations. The best you can do is meet them where they are. Talk softly, give reassurance, and know that even if they don't always react, they can still sense your presence. If a loved one is becoming more forgetful, more confused, or less alert, don't dismiss it. These are usually early warning signs that the body and mind are gearing up for the ultimate transition. This is a period to be tolerant, treasure quiet moments, and concentrate on establishing an atmosphere that feels safe, comfortable, and familiar. Because even when language deteriorates, love and reassurance can still be sensed. Let's proceed to number 4, recurrent infections and delayed recovery. As the body starts to wind down, one of strongest physical sign is a weakened immune system. You may see that the person who almost never got sick before now appears to contract every cold, every flu, every little infection that makes its rounds. What previously were small illnesses now require much more time to shake, and minor injuries like a small bruise or cut heal more noticeably. Slowly, these alterations aren't sporadic. They're indications that the body isn't able anymore to defend, repair itself the way it used to. One of the greatest concerns is repeated infections, pneumonia, your urinary tract infections, UTI skin infections, and even oral infections become more frequent as the immune system fails. Many families think these are just random illnesses, but when they begin to occur regularly or take a long time to recover, it's usually a sign that the body is losing its capacity to fight back. Even antibiotics, which used to work fast, may appear less effective. The individual might require stronger drugs, longer recovery times, or multiple treatments for infections that previously would have been insignificant. This is due to the fact that as circulation slows and organ function is reduced, the body just doesn't react to treatment so well. Another underemphasized problem: chronic wounds. If you find that minor scratches, sores, or bruises are not healing properly or continue to reopen, it could be that circulation is impaired. Poor blood flow is a sign that oxygen and nutrients are not getting to skin and tissues, effectively making healing significantly slower than normal pressure. Sores, particularly in those who are less mobile, become a severe threat and can result in life-threatening infections if not properly managed. What's more alarming is that infections in the last year of life often don't present the way we think. Instead of a high fever, an older person may just be more tired than normal, more confused, or less interested in food. In fact, for older people, a sudden loss of mental acuity is usually the initial warning sign of an infection before other symptoms are evident. This is why it is important to notice these changes early, because it can make a difference in the amount of comfort and care they receive during their last stage of life. For families observing a loved one, experiencing repeated infections can be frustrating and heartbreaking. It is tempting to insist on aggressive treatments, hoping that one more cycle of antibiotics or one more hospital stay will correct the issue. But after a while, the emphasis usually transitions from healing to soothing, ensuring they receive fluids keeping their skin clean and hydrated, and reducing stress on the body can do more for their health than another dose of medication. That only extends suffering. If you're still viewing this video and discovering these observations helpful, please comment number 4 below to inform me you're here. And if you haven't subscribed yet, I suggest you subscribe and enable the bell so you don't miss any videos. Your support enables us to keep producing good content to inform and inspire you. Now let's proceed. Number 5, significant changes in breathing or circulation. One of the most telling indicators that the body is getting ready for its last stage is a perceptible change in breathing patterns in circulation. You might notice that your beloved breathes more slowly or shallowly compared to previously. Sometimes they may pause for a moment between breaths, or their breathing may become irregular, accelerating and then decelerating. Unexpectedly, some individuals have a mild rhythmic pattern of breathing, known as Cheney-Stokes respiration, in which breathing alternates between deep and rapid breathing and prolonged pauses. These variations may begin subtly, but eventually become more exaggerated and more frequent. Another very common sign is weakened circulation. You might notice that their hands and feet, or even their nose and ears, begin to feel cold to touch the skin, might be pale bluish or molded, particularly around the fingers and toes. This is because the body is trying to prioritize the blood flow to essential organs by cutting off the circulation to the extremities. It is an obvious sign that the heart is pumping less forcefully than previously. Some individuals also find they are more breathless, even without doing much. Simply getting up, talking, or changing positions may leave them winded or breathless. You can observe them breathing more frequently through their mouth, or they might need to abruptly halt and catch their breath during conversation. If they used to walk across the room comfortably, but now find themselves exerted just doing so, their lung capacity might be decreasing in some instances. Fluid accumulation in the lungs can complicate breathing. This can result in a chronic cough, sounds of gurgling, or even a sensation of constriction in the chest. Many people think it's only congestion from a cold, but in old people who are approaching the end of their lives, it's usually a sign that the lungs are deteriorating. This can make lying flat uncomfortable, and they might prefer sleeping propped up on pillows or in a recliner to facilitate their breathing. For family members who observe such changes can be terrifying. It's normal to want to assist, to encourage them to breathe more deeply, or to worry that something is amiss. But in most instances, this is just the body's natural manner of winding down. There may not always be a means of turning back the clock on these changes, but there are means of making them more bearable. Keeping the room temperature cool, utilizing a humidifier, or providing small amounts of water to sip can be a means of alleviating discomfort. In some instances, medications or oxygen therapy can be beneficial, but the attention turns to comfort instead of attempting to repair the problem. If you see these symptoms, changes in breathing, cold hands and feet, or a bluish color to the skin, be aware these are usually signs that the body is saving energy and circulation is decreasing. It's a time to be present. Provide reassurance and establish a calm environment where they feel secure and comfortable in these last months or weeks. The most significant thing you can provide them isn't medical intervention. It's comfort, dignity, and the sense that they are not alone. Final thoughts as we reach the conclusion of this video. Take a moment to consider what we've talked about. Important weight loss, severe fatigue, cognitive impairment, repeated infection, and dramatic changes in breathing and circulation. These 5 symptoms crop up in the year before an elderly person dies. They may not all occur simultaneously, and they may or not always clear at first. But when you do begin to notice them, it's a sign that the body is preparing for its final transition. For many families, these changes can be hard to accept. It's natural to want to fight against them, to urge a loved one to eat more, move more, or push through exhaustion. But sometimes the best thing we can do is listen to what their body's telling us. Rather than trying to reverse the inevitable, we can do is to make their remaining time as comfortable, peaceful, and meaningful as possible. Understanding these signs isn't about fearing death, it's about being prepared for it. When you recognize these changes early, you can provide better care. Make key decisions in advance and make sure that your loved one's last months are filled with love and dignity. This is a time for cherishing moments, sharing stories, and letting them know they are appreciated and not alone. If you're seeing these symptoms in someone you care about, take a deep breath and recall that you are not alone on this journey. Many families have gone down this road before.